According to the U.S. Department of Health and Human Services, nearly 8.6 million sports injuries occur each year. Many of these injuries involve damages to the skeletal, muscular, and integumentary systems. Whether it be fractures and sprains or pulled muscles, the application of anatomy and physiology in the field of sports medicine is undeniable. Sports injuries pertaining to the skeletal system are less common in younger individuals, as their skeletons are more resilient and less susceptible to fracture. Some of these bone-related injuries include growth plate injuries, stress fractures, and avulsion fractures. Unlike most skeletal-related sports injuries, younger individuals are more susceptible to growth plate injuries. The growth plate, also known as the epiphysis or epiphyseal plate, is a region of tissue near the ends of long bones that grow during childhood and adolescence. The growth and lengthening of this region results in height increases, and once an individual enters adulthood and is no longer growing, these growth plates close and are no longer active. However, until these growth plates are open and active, they are more susceptible to damage, explaining why children and adolescents are more vulnerable to injuries pertaining to these regions. Males, especially those that take part in competitive sports, are more likely to injure their growth plates. Some causes of these injuries include overuse, sudden accidents, and in rare cases, a medical disorder that can alter normal epiphyseal growth and development. Stress fractures are another type of skeletal-related sports injury, and often occur when too much weight or stress is placed on a weakened bone. Often caused by overuse or repetitive force, stress fractures are small cracks in the bone. Although they can occur anywhere in the body, they are most commonly found in the lower extremities as a result of impact and weight-bearing activities. Three major types of stress fractures include metatarsal, navicular, and rib fractures. Metatarsal stress fractures, as their name suggests, are located in the metatarsal bones. The metatarsals are the long bones in the foot that connect the ankle to the toes, and are commonly fractured in runners, gymnasts, ballet dancers, and hikers, as their activities place continual stress on the feet. Those diagnosed with osteoporosis or inflamed joints are more susceptible to these types of fractures. Navicular fractures are another type of stress fractures in which the navicular, one of the tarsal bones in the ankle, is damaged. These fractures often occur when the foot strikes the ground and are therefore more common in high-impact sports and activities like jumping, basketball, and soccer. Low blood supply in the navicular region makes the healing of minor injuries more difficult, which is often why small injuries to this bone almost always develop into navicular stress fractures. Avulsion fractures are injuries to the bone at a point of attachment to a tendon or ligament. Tendons are bundles of connective tissue that connect muscles to bones, whereas ligaments are bundles of tissue that connect bones to bones. When an avulsion fracture occurs, the tendon or ligament pulls away, and a small piece of bone pulls away with it. Anyone who plays sports is susceptible to such fractures, which often affect bones in the elbow, hip, and ankle.
For many skeletal system-related injuries, assistance from a doctor will be needed, with more severe cases requiring surgery or realignment. To first detect these injuries and to ensure that they are not worse than expected, an X-ray may be needed to determine the type of fracture. One such fracture is a growth plate fracture, which needs to be assessed by a doctor. The treatment needed usually entails realignment performed surgically or by hand, with the addition of a cast or splint. Additionally, stress fractures are another common injury seen within athletes, but there is a lot one can do to avoid it. First of all, knowing your body and your limits is the first step in ensuring you don't injure yourself. Since stress fractures occur as a result of overuse or performing an exercise incorrectly, knowing when to stop and how intense or fast to increase the workouts will ensure you don't get hurt. However, once stress fractures occur, it takes a while to treat them and to return to normal. The major difficulty when diagnosing this kind of fracture is detecting it, because it takes several weeks before the injury shows up on normal x-rays. Yet MRIs and/or bone scans can be more effective. In addition, it takes longer for stress fractures to heal, or it may require surgery to correct the damage. A doctor may prescribe anti-inflammatory medications to reduce the swelling caused by the constant overuse. Something you can do on your own includes stretching and muscle strengthening. This will ensure that after recovering, you will be at your full strength.
Muscle-related sports injuries, some of which include swollen muscles, Achilles tendon ruptures, and rotator cuff injuries, are one of the most common sports injuries. Swollen muscles often occur after intense exercise, as swelling is a natural reaction to injury. Achilles tendon ruptures are another type of muscle-related sport injury and occur when the Achilles tendon tears. The Achilles tendon is a thin, strong tendon at the back of your ankle that can rupture upon intense athletic activity. When this occurs, one may experience sudden, severe pain and difficulty walking. Rotator cuff injuries may occur as a result of injury to the shoulder or extensive degeneration of the tendon tissue. The rotator cuff is a group of muscles and tendons that surround the shoulder joint and keep the upper arm bone within the shoulder socket. Repetitive overhead activity or heavy lifting may irritate the muscles and tendons, resulting in rotator cuff injuries.
Muscular injuries commonly include overexerting the muscle. There's a lot one can do to prevent these injuries, especially in preparation for an athletic event. Performing dynamic stretches before any intense exercise or workout will prepare the muscles and warm them up. This will essentially tell the muscle that it is time to work out and get them ready for intense stretching and contracting. Afterwards, it is also important to do cool-down stretches. This does the opposite of the dynamic stretching, as it tells the body it is time to relax. It will allow the muscles to calm down slowly rather than abruptly. In addition, drinking water before and after and during the workout, as well as drinking something with electrolytes, sodium, and potassium, such as Gatorade before and after, would help prevent muscle injuries. Recovering from injuries to the muscular system can be quite uncomfortable and painful while moving and just sitting down. There are some ways to treat and alleviate this pain. There are many over-the-counter medications used to relax the muscle. Some topical medications include Icy Hot or Biofreeze, which utilize counter irritants as a way to cool and then warm the skin, as a way to distract the body from the muscle pain. However, the problem with these forms of treatment is they don't actually treat the muscle pain. However, heat and cold therapy may be beneficial pain-relieving treatments that actually promote healing. For more acute injuries, cold therapy works the best because it reduces blood flow to that particular region and prevents swelling. Heat therapy is better for muscle pain and helps soothe tension within the muscles. It helps promote healing because it increases blood flow and allows cells from the immune response to get to the site and repair damage.
Although not as frequent as skeletal or muscular-related sports injuries, the integumentary system plays a significant role in sports medicine. Sports injuries pertaining to the integumentary system are of varying intensity. Mild injuries include nail bed injuries and acne mechanica, whereas more severe injuries include transferable skin diseases like Mirza and ringworm. To start off, nail bed injuries are the result of direct trauma to the fingertip and are one of the most common sports injuries. The nail plate is a soft pink tissue that sits underneath the hard part of the nail or nail plate while it grows. Injuries to the nail bed can worsen into subungual hematomas, nail bed lacerations, and nail bed avulsions. They most frequently occur in runners, often due to poor shoe fit, and generally require removal of the nail and nail bed repair. Acne mechanica can cause inflammatory skin lesions such as papules, pustules, and nodules. Papules and pustules are the pink and red bumps known as pimples, whereas nodules are deep lesions that result from inflammation. When it comes to sports, this type of acne occurs when sports clothing traps heat and sweat on the skin. As equipment rubs against the heated skin, the skin becomes irritated, thereby causing new acne breakouts. More severe integumentary-related conditions include transferable skin diseases like MRSA and ringworm. MRSA, short for methicillin-resistant Staphylococcus aureus, is a type of staph bacteria that has become resistant to many antibiotics used to treat ordinary staph infections. MRSA infections are quite common in athletes as the bacteria can spread by skin-to-skin contact or through sharing athletic equipment. Poor hygiene, such as skipping hand washing, can also contribute to the spread of MRSA. Ringworm is also a highly contagious disease common amongst athletes. It spreads through skin-to-skin contact with an infected individual, as well as through sharing of athletic equipment, towels, or clothing.
Injuries to the integumentary system are inevitable in sports, as there are many ways in which this system can be under attack. Some of the more common and minor injuries include blisters, scrapes, and athlete's foot, all of which can be treated with over-the-counter medications from the drugstore. However, there are some more severe injuries that result from close contact. The sharing of equipment and/or contact with another player could allow for the transmission of diseases such as impetigo, MRSA, and much more. The best way to prevent the spreading of these infections would be to regularly clean and disinfect playing surfaces and equipment. It is also a good idea to have your own equipment that is not shared with anyone else.
All in all, whether it be stress fractures, rotator cuff injuries, or MRSA infections, the application of anatomy and physiology in the field of sports medicine is indisputable.